Good afternoon, everyone. We're going to get started here. So welcome. My name is Gabriella Luongo, and I am the Events Officer of the University of Toronto's Public Health Alumni Association. It is my pleasure to welcome you here today to our panel, Having Influence, How Can Public Health Talk to Politicians? And the presentation of the PHAA's Emerging Leader Award. While we are not physically gathered at the University of Toronto today, I would like to take a moment to respectfully acknowledge the traditional territories of the Mississauga of the New Credit First Nation, Anishinaabe, Wendat, Huron, and Haudenosaunee Indigenous peoples on which the Daulana School of Public Health now stands. The territory was the subject of the Dish with One Spoon Wampum Belt Covenant, an agreement between the Iroquois Confederacy and the Confederacy of the Ojibwe and allied nations to peacefully share and care for the resources around the Great Lakes. We would also like to pay our respects to all our ancestors and to our present elders. We are grateful to learn, live, work, and play on the land where the Daulana School of Public Health now stands. If you are interested in learning about the Indigenous territories that cover your area of residence, we encourage you to visit the Native Lands website, and I will post that into the chat shortly. Before we begin, I would like to share a message from our Dean, Dr. Adelstein Brown.
Hi, I'm Steiner Brown. I'm the Dean of the Daulana School of Public Health, and I'm here to say welcome to everyone who's here, but particularly to the members of our alumni community. I'm thrilled tonight that we'll get a chance to present the Emerging Leader Award. At this time of a public health crisis, the importance of leaders at all levels of the development has got to be clear to everyone. Unless we have strong leadership in public health, we don't have a strong public health system. I'm really pleased as well that we've got a great panel to talk with us today. I know that my colleague Rob Steiner will be moderating. Rob is someone who has made sure that we've got great exposure of critical policy ideas to broader audiences. And I'm starting to think that journalism and advocacy really are key competencies within public health. I see you have Dr. Akwatu Khenti and Dr. Kate Mulligan as well, two people who are both important members of our school, but also people whose whole career has been about making an impact on public health and health systems. You also have MPP Jeremy Roberts, who is, I think, single-handedly trying to make sure that we get strong, good public health information out there, in addition to his day job, which I know is quite taxing as well. So with all that, I'm just really thrilled that we've got the Public Health Alumni Association here tonight. I'm really glad that we've got this topic for the event because the importance of impact has never been greater. And I'll close by saying that one of the things that does give me strength and a lot of comfort during the current crisis is the role that our alumni have across the province, across the country, and globally in responding to the COVID-19 pandemic and to the many other public health challenges that face our societies. With that, I hope everyone has a great event, and I wish everyone well and good health.
So before I introduce the panel, I would just like to cover a few housekeeping items. So first, if you have any questions during the panel for our panelists, please use the Q&A function at the bottom right-hand side of your screen. If the questions are directed to specific panelists, please also indicate that. And we have collated questions from attendees that have been submitted in advance of this event. So we will try our best to cover the topics that have been already mentioned. Second, you can use the chat for any general comments. However, they may or may not be acknowledged. So if you do have questions, please use the Q&A chat. We will also be recording this session, and the recording will be posted on the Daulana School of Public Health YouTube page, and you will receive a link to that after this event as well. And finally, we understand that given the ongoing COVID-19 pandemic, the discussion around health and politics is rather contentious. And this event is meant to provide an opportunity for public health practitioners to learn about the decision-making process and how they can best communicate with politicians. And on that, we will not tolerate any disrespectful comments or questions throughout this event. So without further ado, it is my pleasure to introduce our moderator, Robert Steiner. Robert is an assistant professor and director of the Fellowship in Global Journalism at the Dahlonega School of Public Health, with an extensive background in journalism and communications from his work as a global finance correspondent with the Wall Street Journal and executive roles with the Boston Consulting Group and Bell Globe Media. So now I'd like to turn it over to Rob and the panelists, if you can turn on your video so that we can see you all.
So I can't turn on my video because the host has stopped it, but you can hear me anyway, right?
Yes, we can. And now you can turn on your video. There you
Awesome.
go.
That's great. Thank you very much. Thanks, Gabriella, and Steiny remotely. I'm really happy. I'm just going to say a couple of very quick words up front about how we're going to do this. And I'll just add one little thing to I'll add one thing to my own background, just so that you know I'm not coming at this as a finance reporter from the Wall Street Journal. I've actually, way back post-SARS, I was already a health policy advisor and public health policy advisor to Paul Martin at the time, who was about to become Prime Minister of Canada. And so ended up getting quite involved in the creation of the Public Health Agency of Canada. And that over the last almost 20 years has led me into a career in public health communications, and other kinds of scientific communications at U of T. And my one little plug, and I'll come back to it at the end, is that if these topics are of interest to anyone at all on the call, we actually teach a couple of programs around this at Dahlonega, the Fellowship in Global Journalism, which we're recruiting for now, and the Certificate in Health Impact. And so, Kate teaches in the Certificate in Health Impact and is also an alumna of it, although she had all the skills before she came into it, to be honest. So without further ado, I'm very happy to chat about those things offline with anyone who's interested. I'm really excited that the Alumni Association has chosen this kind of topic about the sort of front line, if you will, between politics and public health and public health science. One thing that has struck me since joining the Public Health Academy a few years ago is that when my colleagues in public health talk about policymakers, it's as if we're sort of talking with one broad brush stroke, which would sort of be like talking about scientists as if all scientists were the same, or healthcare professionals as if there were no difference between a respiratory therapist, a physician, and a nurse. Policymakers, and this is true of any context, particularly in democratic context, but it applies, even sadly in authoritarian context, there is a real difference between, and I'll speak in the democratic context here because it's what's relevant for us. There's a real difference between the people we elect and the people who are making careers in a particular policy area and who are acting as public servants. I think, unfortunately, sometimes we disdain the people we elect. And when we work in authoritarian contexts as public health professionals, one of the first things that we always say is democracy is a social determinant of health. And then when we're in a democracy, we sort of roll our eyes at the people we elect. And it's important to note, first of all, at least in my experience, having worked a lot in politics, the people we elect are sincere. They may have, they'll clearly have a range of opinions, but they're sincere, they're serious, they want to do the work well, and they want to do the work on behalf of the people who elected them, all the people who elected them, A. And B, that they are actually the decision makers on most of the files that we care about as public health professionals and scientists. The real decision makers on the contentious files are not the senior public servants. They are actually the politicians, the ministers, the caucus members, the premier, the prime minister, the mayor. I know we have Americans with us, the governor. Those are actually the decision makers. And so, it's important that we understand how to speak with them and how to hear them in a way that is distinct from the way that we speak with our sisters and brothers who are in the policy world, who we may be more comfortable with. So with all of that as a premise, here's what I wanted to suggest we do today. We're going to start off with each of our guests in turn. I'll introduce them briefly. They all have massively impressive bios, and I could go on and on about all of them, but I'll abridge it and introduce each of them in turn. Ask each of them to address, this question of where the public health world and the political world clash or come together in their experience. And then we'll go into questions. I'll have a couple of questions up front, maybe, but I will be watching the Q&A, and we have some that came in. Just to add to the housekeeping point, we are inevitably going to be talking about some real issues that are live, but a couple of important things. One is, I was very happy to see that there's a wide range of folks from all over the world here. We have folks in, and welcome and thank you for coming from across Canada, from BC, Northwest Territories. We have someone in government from the Yukon, which is really cool because there may be new government in the Yukon, Alberta, across Ontario, Ottawa, Guelph, and elsewhere. And we also have folks joining us from Texas and France. So let's not get into the weeds on Ontario political debates, but as the issues come up, let's use them as examples, ways to illustrate the dynamics, which I think are as evident in Texas or in Paris as they are in Whitehorse or Toronto. Okay, so without further ado, I want to start by introducing my colleague Akwatu, and I think if we go by sort of first names, that would be awesome, casual and collegial, if that's okay. So Akwatu Khenti, as a scientist, he is affiliated with the Institute of Mental Health Policy Research in CAMH, the largest mental health hospital in Canada. He's also, my colleague, is an assistant professor at DLSPH. He has a serious background as a leader in Black mental health and substance abuse issues across Latin America and Caribbean communities, in Canada, across the Western Hemisphere, including Latin America and the Caribbean. And he also has been right at the middle of these kinds of discussions, at the forefront of politics and health, public health policy. He was Assistant Deputy Minister for Ontario's Anti-Racism Directorate, and he's currently a Special Advisor to the City of Toronto's COVID-19 Equity Initiative, and he's Chair of the Black Scientist Task Force on Vaccine Equity, or he was, if I have that right, was Chair. I'm sorry if I got that wrong, Akwatu, but I will pass over to you for about, let's start 3 to 5 minutes or so, and then we'll go to Jeremy and Kate.
Yeah, so thank you so much, Rob. Thank you so much for this opportunity. And I don't even think I need 3 minutes. I think there's 3 areas where there's alignment between public health and policymakers, and 3 areas, key areas where we're not fully aligned. There's some partial alignment, but more needs to be done. I think there's alignment on the need to reduce COVID positivity and hospitalization rates. I also think there's alignment on the need to effectively reduce vaccine hesitancy through public education. I would also say there's an alignment on the need to build herd immunity through mass immunization. Where we are not fully aligned is on the social determinants of health, issues related to income, sick leave, housing, etc. I don't think we are fully aligned on health equity, especially racialized risk due to employment and systemic racism. And I would want us to aim for it, but there is an aspirational goal to be aligned on an all of government approach to the pandemic and to mass immunization, one that is coherent, unified, and strategic across the different levels of government, municipal, provincial, and federal. That's the gold standard, and that's the key area of alignment that I think that we need to be on. That's my introduction. Thank you, Rob.
That actually does the job perfectly of putting at some clear markers that we can follow up with in a deeper discussion. And I actually want to signal one of the sort of misalignments that you're talking about here, which we might dive a little bit more into, is also misalignments between different orders of government. We have at least 3, and really 4 or 5 different orders of government in Canada: federal, provincial, municipal, and regional. But then we also have, thankfully, at this stage in our history, First Nations and Indigenous governments, which is another order of government. And sitting on the science advisory table where I do, it boggles the mind how often these folks aren't on the same page, and we get tossed back and forth. So thank you for signaling that to us too. Let me jump next to Jeremy. So if you'll just bear with me for a quick second. So, just a moment here, sorry. I'm toggling between screens. Jeremy, I had the pleasure of meeting Jeremy Roberts a couple of months ago. I work on the Science Advisory Table as Director of Communications there. That's our COVID Science Advisory Table in Ontario. And Jeremy, who's a member of the governing Progressive Conservative caucus in this province, approached us wanting to do a town hall in his riding in Eastern Ontario, in the suburbs of Ottawa. Wanted to do a town hall with the folks in his riding about why COVID and the flu are not the same, and that people need to take COVID very seriously. And so we got to know each other just a little bit through that, and then through this. By background, Jeremy was elected MPP for Ottawa West-Nepean in 2018. He's served as vice chair of the Finance Committee, and now he's the parliamentary assistant to the Minister of Children, Community and Social Services. The interesting thing for us on top of all of that is that he's also very deeply connected to healthcare and chronic health. He actually got into politics when he was 14 years old in order to advocate for his brother who has autism. He just got the top volunteer award from CHEO, the Children's Health Hospital in Eastern Ontario, based in Ottawa. And he also has a deep background in public policy. He did his graduate work in public policy at Oxford before coming back to Canada and entering elected politics. So Jeremy, over to you.
Well, thanks so much, Rob, and real pleasure to be here today. I have the arduous task of being the politician on this panel today, so go easy on me. Although, as a politician, I promise I will stay fully clothed for the entire presentation today. Too soon, maybe, we'll see. But Rob, thanks again for the invitation. I've been struck throughout this pandemic. You mentioned I was fortunate to do my educational background in public policy. And as part of my public policy degree, one of the things that the university did is they tried to train future public policy practitioners on how to interact with different types of experts. So whether it was how to interact with lawyers or economists, or as is relevant for today's discussion, how to interact with scientists. And that was really fantastic because, of course, as a politician or as a civil servant or whatever your background might be, you may not be an expert in any one of these particular areas. You may be more of a generalist. And so being able to understand how to work with those different types of people is so important, because at the end of the day, as Rob said, so often we are the folks who are ultimately making those big decisions. Now, in an ideal world, it would be great if all of our decision makers had that sort of professional training on how to deal with scientists or how to deal with whatever types of experts it might be. But of course, we don't live in that world, and our politicians across a variety of different parties, come from so many different backgrounds. We've got business people, lawyers, farmers, social workers, the whole spectrum. And so often the onus actually falls on you as public health professionals, as scientists, to figure out how do you communicate with us. And so what I'd like to do today as part of the discussion is talk a little bit about the thought process of politicians. How is it that politicians think about issues, to try and help give you a better understanding of sort of how to approach politicians or when you're trying to advocate on a particular issue. And then on the flip side, I'd also like to talk a little bit about some of the things that I think are the most challenging pieces of connecting those dots between a scientist's thought process and a politician's. And I think the biggest piece there is around the idea of uncertainty. The science view of uncertainty, I think, is very different than the politician's view. For a scientist, I think you're much more comfortable with the idea of uncertainty. It's part of the day-to-day workings, and you're looking to achieve consensus around things. You're never necessarily hoping to achieve 100% certainty because that's so difficult. Whereas for politicians, uncertainty is often something that you need to be very afraid of, or alternatively that can be exploited. And so it's two very different approaches to that idea of scientific uncertainty. So I'm hoping to dive in a little bit on that through today's questions. So really pleased to be here. Thank you so much again for the invitation, Rob, and looking forward to some thoughtful questions and discussions today.
Yeah, Jeremy, thank you very much. In fact, your question about or your insight about uncertainty mirrors one of the first two questions I wanted to ask, which actually comes in from one of the attendees, which was basically how to best advocate with government. And by government, I think we're speaking about the political side of government now, because now that we're sort of exposing the distinction, but how best to advocate with government when hard data are missing or not readily available. So I'll park that question and come back to it in a second and let you start to mull on it. While I go over to Kate Mulligan, Kate, colleague, a friend, oddly, I always feel weird saying, former student in my program, because I have the good fortune in the programs that I teach to be teaching people who are much more experienced than I am. So really much more peers than students. But Kate was in our certificate in health impact program last year at the beginning of COVID, right through from well before that as well. She's a colleague, assistant professor in social and behavioral health sciences at DLSPH. She's a public member of the Toronto Board of Health, but I think the bio that she sent us really understates some of the roles that she's played. She is a leader in Ontario in community level public health, has been really successful advocating for community level public health with a range of different governments coming from different political perspectives, which is one of the reasons why I've asked her to actually teach our certificate students this year. She's a globally recognized advocate, policy maker, researcher in health equity and community well-being. And she's teaching also in DLSPH's new Doctor PH program. So by the way, those of you who are interested in getting a Doctor PH, the first one of its kind in Canada, professional doctorate degree in public health, not a PhD, that's coming up at U of T as well. So anyway, over to you, Kate.
Thanks, Rob, and thank you to all of you for being here today. This is one of my favorite things to talk about, and I'm glad so many of you are interested. I think it is really important, as Dean Brown noted, that this really is considered a core competency for people trying to do the work of public health, whether or not you're in institutional public health or in another setting. So I got my start as an intern at the Ontario Legislature at Queen's Park. And so my first job out of graduate school was spending half the year hanging around with an opposition MPP, half the year hanging around with a government MPP. And so really got an early sense of what that last mile of policymaking and legislation and politics really looks like. And I think that was a really important foundational training. And I went on to stay and work for the NDP as the researcher for health and social policy for a number of years after that, really getting a sense of how the policy and political process work here in our province. And so that provided good training. You know, I went on to work in public health for Toronto Public Health, work with the community health centers, keeping in tow in academia. And one thing that I do now is that I often join colleagues from around the world in helping them to speak to decision makers in their countries. So on matters related to community health and well-being and public health, where they need to make a case, they need to make an argument for the kind of work that they are trying to do, that they want to do. And so I've been spending time with people from countries around the world doing that. And so there are a couple of things that I think are really important that I'm hoping we can talk more about when we talk about the differences in cultures between public health and academia and politics and policy. And they're all slightly different, even just those terms. But one of the ones that community health shares with politics is a culture of really rolling up your sleeves and getting things done, a willingness to look at what is possible in the moment and to really try as much as possible to come together and to collaborate and get things done. And we see that really clearly at the municipal level, where that consensus style governance is really important. And so I spend a lot of time on the Board of Health, working with the politicians on the board, the chair, Joe Cressy, for example, and others, trying to get things done, move the needle even a little bit from where we are now. And that might be a little bit strange and a little bit different to people who are accustomed to maybe a bigger institutional culture, things happening more slowly, accumulating lots of evidence, following lots of hierarchical procedures. Things move quite differently within the bureaucracies that you might find yourselves in, or within the academic institutions you find yourselves in. So the cultures are really different. And I think it's really important to just really begin with that understanding that that the level of evidence that you might require to make a decision might be quite different. The type of evidence might be quite different. And the source of the evidence might be kind of quite different as well. And so, I think when we're talking about political decision-making, authority and legitimacy are just as important as scientific literacy and expertise. In other words, politicians and all of us are not going to be experts in the core details of the science. We're not all COVID epidemiologists. We're not all climate scientists. We do rely on expertise, authority, and legitimacy. And so if you're building up a campaign, if you're building up expertise in trying to get things done, it's important for you to carve out that piece of credibility and authority and expertise for yourself so that you are seen as a trusted voice in moments of change. So I have lots more things I'd love to talk about. The one more that I'll mention before we carry on is the importance of accountability in politics. That what we, one of the things that we need to build toward is not just encouraging politicians to make decisions because we somehow think they're the right thing to do or the moral thing to do or the evidence-based thing to do, but building accountabilities that demonstrate why we need to get there, how we need to get there, and then hold people accountable for actually getting there. And as we started to do that on matters of health equity, we started to see progress. So for example, requiring consultation with and deep partnership with Indigenous communities ensures that happens, at least to some degree. And that's the kind of thing we need to build accountabilities for with other populations who are facing significant barriers to health equity and well-being. I'll leave it there for now, thanks.
That's a lot of great stuff. And to be clear, my sense when you talk about accountability is, I'll put a blunter term on it. It's almost like having a structure that leads to a report card, so that you actually need to fill this out. It's not right, and not filling it out for the purpose of checking a box, because that's not the point. But incorporating things into a process that you're accountable for. If you'll excuse my dangled participle. Wow. Okay, so there's a lot to get into here. Clearly. And what's nice about the way you guys have set this up is that it actually aligns really well with a number of the questions that we're now getting in the Q&A, and that we also got before. So a few things come to mind. Here are the three questions that I'd sort of like to throw to you, but in order. I don't want to throw them all at once. I'd like to, I'm not even going to put them all because then we'll be tempted to answer all of them at the same time. But I'd like to start and just throw these out to all of you guys. With what the scientists might call the pathogenesis of the problem. Why is there, to go back to Akwatu's language, your insights, why is there actually this misalignment around the things where there is a misalignment? We've started to, we've gotten some hints of it in the conversation so far around uncertainty and so on, but where does that misalignment start? And then we can get into some of the other topics that you guys are raising, more specifically around uncertainty and so on. Who'd like to jump in first on the misalignment? Maybe Akwatu, you raised it, so why don't we start first with you if you can. Do you have a sense of where this starts?
On the misalignment, I think well, we answer to different institutions and different stakeholders, different sectors, and public health has to adhere to sort of the rigor of the science, the rigor of what the data tells us. And as long as we are comfortable delivering that, but politicians have to respond to their various stakeholders groups as well as interest groups. And so it complicates the mix. And then of course, there's the public opinion, which also drives the agenda and can actually lead to declarations before you actually have the operational capacity to turn a decision into reality. That would be my sort of short answer. The social determinants of health issues really has been around for a while, but it's costly to apply a social determinants of health perspective in real political time. You would have to have a mass mobilization of our public health stakeholders to sort of drive that change and sustain that change, because there's so many interests that would not be able to support it because of the costs associated with it. We could talk about the fiscal priorities, and that's one of the real issues which serve as a barrier to fulfilling the promise of social determinants of health.
Mm. And lest this sound like a partisan issue, I mean, I can say, having been, I'm not affiliated with anyone anymore, but I spent a number of years deeply involved in the Federal Liberal Party. And I can tell you that by the time we left office, we'd not solved social determinants of health, and I'm not even sure that we paid a whole lot of attention to it. And in jurisdictions that are run by the NDP, like BC, you still have, you know, terrible situations all over the place. The downtown east side will be there when the NDP leaves, sadly, in Vancouver. And so these are not, I'm sure there's a partisan dimension to it, but there's something in the actual clash there. So let me toss it over. I don't mean that we necessarily always have to keep going back in the same order, but just because it sort of begs the question, I'll toss it over to Jeremy for reflections on where these misalignments start. Speaking as much as you study this academically as anything else.
Yeah, you know, I think this is probably a good time for me to talk a little bit about the political thought process and sort of, you know, how do politicians identify issues that they want to act upon? You know, typically a politician is going to get elected and they're going to have a set of their own priorities that come from their personal experiences, their ideological backgrounds, whatever it might be. You'll have a set of issues that you have to deal with by nature of kind of being reactive to what's happening around you. And you know, I keep making the joke, when I got elected in 2018, I didn't expect Mother Nature to have so much in store. We had right after 2018, we had a tornado go through Ottawa. We had massive flooding along the northern part of my riding, and then we've had the pandemic. So three things that I didn't necessarily foresee, but have become very major parts of issues that I've had to react with. But then that last bit is how do politicians pick other issues that perhaps a stakeholder group brings forward? And this is where I think it's relevant to this discussion in terms of public health folks coming forward to government and trying to get on the government agenda. And I love to go back. There's a political strategist out of Australia who identified that he has a theory that there are three reasons why a politician picks a particular issue. The first is that is the issue salient? Is it something that a lot of people are talking about, that's out there in public discourse? The second is it personally relevant to people? If a government is going to take action on something, will people connect, okay, the government has done this and this is how it impacts me in my day-to-day life? And the third is, will the issue differentiate me from my political opponents? And oftentimes you see that you know, the issues that end up getting acted upon in government, that end up making it onto the agenda, tick off either one or multiple of those three boxes. You know, and I think back on some I guess, you know, issues that have come to my attention. Most recently, I've been working closely with the Children's Hospital in Ottawa on a project they have there called One Door for Care, which will kind of bring all of the mental health, special needs, and rehabilitative care that's provided to children in Ottawa and put it under one roof at the CHEO campus in Ottawa, so that if a family is in crisis with a child with a mental health issue, you don't have to figure out where you have to go. You know, you go to CHEO and there's One Door for Care. And so, you know, this issue was brought to my attention, and the team at CHEO did a brilliant job illustrating for government how, you know, this is tremendously salient, particularly right now during COVID, as we're seeing so many issues around mental health with children, very personally relevant. You know, most families have, whether it's one of their own kids or one of their friends or a family member who would have benefited from these types of services. So it ticked off a lot of those boxes, and we saw that get put on the government's agenda and saw it acted upon. So I think in terms of that misalignment, you know, it may come sometimes where, you know, it's tough to bring an issue and try and tick off some of those boxes and push it onto that agenda, because there's only so much room on the agenda, not just from the fiscal point of view, as Akwatu mentioned, which is of course a huge piece. You know, there's only a limited amount of resources to divvy up, but also just based on the bandwidth of the decision makers. You know, you only have so much bandwidth to deal with, you know, your personal priorities, your party's priorities, your reactive priorities, and then that new group. There's only so much bandwidth. So you want to try as much as possible to tick off those boxes.
You know, that structure, it's interesting. I would love for you, maybe in a second, you can throw the name of this Australian political theorist or strategist into the chat, because that formulation you're describing is exactly what I came to after working on a couple of national campaigns. And the trickiest part, I'm guessing, and I'll throw this to Kate, I'm guessing that the trickiest part for those of us working in public health is actually that third category of, you know, what politicians call the wedge, right? This needs to be, you know, in your case, I would imagine, if I'm bringing you if I'm bringing you something for political action, at a certain level, it needs to be something that a conservative can do, that a liberal or an NDP guy, and I don't mean guy, man, but, you know, a liberal NDP player could not do, or could not do credibly. That's the wedge, and that's where it becomes a political thing. And that's really hard for us when we are looking at public health, which is an evidence-based public good that shouldn't be more in line with one sort of political camp than another, and that's not how the science works. But we sort of have to articulate it or think of it in a way that gives it a win for one political side, which is, I think that may be where public health professionals and scientists start to roll their eyes. And yet it's a really important part of our democracy because we are actually giving people choices when they vote. So that might be a kind of obscure way of making the point, but I'll go over to Kate, because you've done this very effectively in different political contexts in this province.
Yeah, my experience is that wedge politics isn't necessarily conducive to some of the work that we are trying to do in public health, and that's okay. Because what we're trying to do is find a narrative and a way in for multiple different stakeholders, multiple different decision makers, multiple different rights holders. And so, for example, one of the things that I'm very interested in is social prescribing around the world, which is a way to help use the health system to refer people to social determinants of health services and really value their own agency in that process. That's something that, I think all three parties that we have in our political system can get behind. Some maybe more on the structural side around we need to address social determinants of health like housing, some on the individual agency side of supporting individual people to make good decisions and healthy decisions in their lives, right? And so there are points of entry. And so one of the things that we need to improve at in public health is our comfort in speaking to those different starting points and different endpoints, maybe, to find the value proposition. What problem can I solve for you that will also help me solve the problem that I'm interested in, or both, right? And so if we can say, this will also save the health system money, and that's something everybody wants. I don't think that, we can't find a wedge between those people who want to save money and those who don't. But it's still something that all are going to be interested in. It's not the only deciding factor, as Jeremy said. I think we might overplay that a little bit, but we want to point to, there's clinical evidence, there is feasibility evidence, there is economic evidence, there is demand. One of the things that I think is most important is showing that demand, which is why it is important to do advocacy, social media, mainstream media, because the access to politicians doesn't only come in those direct conversations. It comes in the clips package they get every morning, in the names they start seeing over and over again in the media, in the relationships that you've built with them. Many are involved on social media and willing to have conversations and wanting to learn. Going to make deputations in front of bills and people seeing you as a regular presence with a regular message. All those things are really important. And so I don't want to overplay the wedge piece, because it's important in certain moments, like campaigns, like the very end of a legislative process, but there are lots and lots of moments where it's not appropriate. And so and that some of that, from my experience, just comes with experience.
I love that formulation, because the risk, it's something I'm very conscious of as comms director for the Science Advisory Table here in Ontario. In my mind, in my line of work, in my sort of little piece of public health, the greatest public health risk is polarization. Polarization creates stasis throughout the whole system, makes it impossible to move in any direction. And with communicable disease, it's completely unhelpful. But the idea that you need to think about the different points of entry, and that the point of entry is not just the data, it's not just the data. There is an angle to the data. There's an approach to, and that on something that is of shared value, different stakeholders will have different points of entry. You have to be sensitive to that and be listening to the politicians and the people around the politicians, their fellow travelers, to understand what the relevant point of entry is. That's a really, like, if someone takes a note and remembers something out of this conversation, I think that's a really nice way to put it. Parents, anyone who's on here who's a parent, this will start to sound very familiar. Let me go into this question about, and sorry, I should also note that this, you were also raising the social media point. That's also come up as one of the questions in the Q&A. What do folks actually think of social media? There's some other topics I want to get to, but I just want to signal that social media is a really important connector here. Politicians are on it, we're on it, and it's an important connector. Not a great place to burn people. In fact, I would urge people not to do that. But I'm glad that you raised a point about social media. Let me get to another question that came up, and it taps into something that all of you raised in the opening remarks, which is uncertainty, and uncertainty as one of the contributors to these different frameworks. How do you, I'll throw it, and then whoever wants to jump in can jump in. How do we deal with, well, I'll put the question that someone actually wrote it here. How do we best advocate with government when hard data are missing or not readily available? Anywhere you want to go with that.
Maybe I can start and lead us off on that one, Rob. But I think uncertainty, as I mentioned in my opening remarks, is one of those most difficult bridges, issues to bridge between politicians and scientists, because again, as I mentioned, uncertainty is much more a part of the daily experience for scientists, whereas for politicians in the kind of environment that we work in, oftentimes uncertainty is something to be scared of, or alternatively, you do see some politicians exploiting it. There's a wonderful book called Merchants of Doubt that was written a couple of years back, and it goes through a number of major scientific public policy debates of the past several decades: secondhand smoke, acid rain, etc. And there very much could be a whole new chapter to that book written on COVID. And the book documents how certain people have used uncertainty in science to build in doubt around the science. And this is something that I think it's so important for scientists to think of when you're meeting with politicians, is figure out ways to explain to them that uncertainty. Make sure you're explaining to them the scientific process, and how the scientific process, you're looking to find a consensus based on peer-reviewed research, and that there is always going to be uncertainty. I think about a recent example. We had a briefing recently from a member of Public Health Ontario who talked to some of the politicians about vaccines. And one of the questions that kept coming up from the politicians is, well, I'm hearing from constituents who are worried that they could get sick or die from the COVID vaccine. Now that I've spoken to you, can I go back to them and say, absolutely, you cannot get sick or die from taking a COVID vaccine? And the scientist said, well, unfortunately, there's a bit of uncertainty here. And she walked through and explained how, obviously, once you get a vaccine, you could have a very strong immunoresponse to it, which could, play out in some symptoms of being ill. You could receive the COVID vaccine, but have just been exposed to COVID before and still contract it. So there's a lot of factors in there that make it impossible for someone to say, you absolutely will not get sick or die from taking a COVID vaccine. And so this particular scientist did a brilliant job of explaining to the politicians that uncertainty, and explaining to them that while that uncertainty exists, we don't want to focus on that, because there is this scientific consensus that as a whole, you're much better off having gotten the vaccine than if you didn't. And so, just making sure that you're taking that into account, and that when a politician asks you a question about something where there is uncertainty, walk them through why that uncertainty exists, but then pivot back to that scientific consensus piece as well.
It's really helpful. Anyone else want to jump in on this?
Yeah, I can do
Akwatu?
that.
Yeah.
You know, here's the contradiction. Jeremy mentioned how politicians look for the niche. Where's the niche for their constituents? Whereas from the public health point of view, you're trying to craft a narrative that can appeal to politicians of all stripes. And where that has worked particularly well is with mental health stigma, where stigma has affected individuals with mental health problems, their families, their communities, and the potential solutions, how to reduce mental health stigma in healthcare in public spaces. You know, the way the issues that people with disabilities or mental illness face was described and outlined actually created, I think, a support across all political spectrums, political arenas, to address mental health stigma in society and to reduce it. And I believe that if you can clearly identify and articulate the problem as well as particular solutions, you may be able to gain the attention of decision makers in the absence of data and statistics. That narrative, the individual in the narrative, or the way the story is told, can have a huge impact, especially if it has legs in the media.
Yeah. Kate.
Rob, I know you didn't want us to talk too much about talking with the civil servants behind the scenes, but it is really important.
Yeah, let's.
I think it's another sort of leg of the table that you, and why that's important is because, and I think both Akwatu and Jeremy sort of alluded to this, that the more you can come with a solution that's actionable, the better. And right now in this moment of COVID-19, the civil servants and the politicians and the rest of us are really, really tired. It's really difficult to think creatively and in a new way under these kinds of conditions. If you're able to come with a clearly identified problem that you can help them solve and a clear solution that's actionable, you're going to be going a long way. And so you do need to build those relationships and the respect of the civil servants who can say and give the advice that, yes, this is actionable. Yes, this helps us with our problems, that, you know, this is something that is going to be palatable to the people it's going to affect when we implement it, right? Like, so the healthcare associations, for example, or the teachers or the parents. And so, though, you know, I think it is also important to have built a relationship and a piece of trust there, and to consider that feasibility to be a really important part of the work. And certainly when we look at, you know, even some government reports, but lots of academic reports about important public health matters, when you get to their policy prescriptions and recommendations at the end of the paper, they just don't meet that sniff test of what's feasible, what's actionable, what's salient, what's au courant, you know. And so that's the piece right there that we're getting at today. And it happens in relationship. And so the more you can have relationships with the different kinds of decision makers at those different levels of government, in your communities, influential people, and so on, the more ready you're going to be. And so one example that came up a year ago now is the collection and use of sociodemographic and race-based data. It wasn't happening. It was a clear crisis and priority. We felt that it was really important. People like Akwatu had been working on it for years, had actionable solutions ready to go. But what we were able to do was use social media, create petitions, link to key influential journalists, put huge pressure on, and then be able to say, not only is there need, not only is there demand, there's also solution, and here we go. And also to make that happen at multiple levels of government, starting with the municipal level where there was more readiness and more consensus, and pushing onward and upward, which continues, right? And it's not done, and there are many challenges around it, but the constellation of relationships around the researchers, the advocates, the journalists, the decision makers, and so on, was ready for when that moment arose.
That's awesome. That is a great way. God, we could keep going for an hour. I can't quite believe that we're just at about time. Let me cap that off just a little bit and integrate some stuff, and then thank you. You raised two really important points there, which I want to underscore. One is the relationship piece, and part of the relationship piece when we're speaking with anyone, right, is to understand their own perspective. If we have clinicians here on the call, clinicians who practice in a sort of patient-centered model will understand this, that because a patient may not be adherent doesn't mean that they're ignorant or they're resistant or they're, you know, non-compliant in some terrible way. it means that there's some other thing going on with them. So the fact that Ontario was not collecting race-based health data, there were reasons for that were worth understanding, and a lot of it, for a Jew who's the child of a Holocaust survivor, race-based health data means something in particular because it's how the Germans started their whole process. So Canada stopped doing that for particular reasons that are no longer relevant, and that in fact have created dangers. But as one example, getting into understanding where politicians and decision makers are coming from and accepting the legitimacy of that perspective, even if you don't agree with it, is a core part of building the relationship, in my sense. And the other thing that I love that this came up, from everyone here is solving the problem, bearing in mind that when you speak to a politician in particular, the problem is not just the policy problem itself, which it is. The other problem that, in my experience, politicians are always saying about who's going to come after me for this. If I do this thing, which is obviously the right thing to do, who's going to come after me? And that's also a problem that we can afford to think about as public health people. Yeah, the context for this is complicated. Yeah, those folks might come after you. Here's how you address that. Or in fact, we've already spoken with those folks over there. And we're actually aligned on this, believe it or not. And so you're not going to get sniped from the side, because constantly calling on people to sacrifice themselves in their positions or their parties, whatever, for evidence is hard. Okay, so there's a whole lot of stuff here. The things that I'm coming away with are solve the problem. Don't just present the problem, but solve the problem in a way that is actionable. Do this in the context of relationships which take time to build, relationships of respect, wherever you or your interlocutors may fall on the political spectrum. Uncertainty is a key source of the disconnect, but we as scientists in the scientific community can pivot from uncertainty to consensus. Consensus is not absolute. Consensus acknowledges uncertainty, and if you can combine an explanation of the scientific process and the nature of scientific uncertainty, which is different than other kinds of uncertainty, the nature and legitimacy of scientific uncertainty, you can put that in context and say, but here's the consensus. Again, clinicians who are joining us will know how they speak with patients, and it's a very similar kind of thing, I think. And I love this idea of points of entry, that we don't have to wedge or polarize. We don't have to sort of pile in on one side and amplify the polarization of debate. We're working at public health on public health. And we could find points of entry to that. One thing that we've not had the chance to discuss, and I really wanted to get there, but I think all of this lends to it too. I just want to acknowledge that we haven't discussed it, is that there's a whole there's a whole particular set of issues around equity that is so critical and means it at the end of the day, as I've sort of learned from Akwatu and from others, that one message doesn't work for everyone. And we have to be particularly sensitive to that right up front. So I know that we're at time, and I apologize that we did not get to that, but I hope that the general framework that we've discussed will help people address those issues as well. Are there any, just, I'm going to toss back to my colleagues, to Gabriella, but is there any last word that I'm missing here that you guys want to come in on?
Maybe the one last thing I might just mention, Rob, if folks are looking for one really, really good thing to read about the relationship between public policy makers, politicians, and scientists, check out the book, The Honest Broker by Roger Pike. And I'll put the name in the bucket, and it talks about the different types of scientists and what the gold standard is for a type of scientist that interacts with politicians, and that's the honest broker. And this is someone who expands and clarifies the range of possibilities to a decision maker and helps them understand the different factors at play. And I really think that summarizes a lot of the different pieces we were talking about today, and so would highly recommend that. The honest brokers, I think, are the ones that are succeeding right now in helping make sure we're getting through this pandemic. So
I'm going to order that as soon as we're off, because I could use the advice. Fantastic. Thank you guys so much. Gabriella.
I think Akwatu had we have a few more minutes. So if you want to do some final from Akwatu and Kate, that's totally fine.
Yeah. Oh, thanks. I'm glad for the time, Akwatu.
Yeah, I just wanted to say that the one area that we didn't touch on, which I was looking forward to elaborating, it's about public health position around the need for global health equity, global vaccine equity, in order to prevent new variants from emerging that threaten our health. And we keep forgetting that COVID-19 is a global health threat. It's increased the global health burden for everyone, but especially for the low and middle income countries. And we in public health, who have really been at the forefront of the global health movement, the global health, whether it's global mental health or global public health, need to remember that there are many sort of forces taking us in the opposite direction because of the sort of vaccine nationalism, vaccine hoarding, misuse of COVAX, and public health needs to be at the forefront of an equity agenda that really protects ourselves from the variants, but also addresses the huge unmet needs across the world. That I had to get that point across.
I'm so glad you did, because we think of variants and we think closed borders, and we sort of inaccurately throw these national labels on variants. And actually, the only way to address variants is to make the reservoir of variant reproduction, i.e., human beings, less and less susceptible to infection to begin with. And so, vaccine is really the only strategy to address variants. Yeah, thank you. I'm very glad you raised that. And that also, raises the need to be able to have these conversations at the international level, right? With international bodies and with the foreign ministries within our countries who are advocating at the international level. And PHAC, fortunately, Health Canada have, their own diplomatic services effectively, and they're really important. And actually, Canada's listened to still in the world on this stuff. Kate, did you have a last word you wanted to throw in?
Yeah, just around, the title of our session and in talking to politicians, that, politicians are people, we are, and they're us, right? They represent us. And public health is also political. And so there's, distinction is maybe not as great as we think sometimes. But what I wanted to say about that was that if we want people on the other side of the phone to really hear what we're saying, we need to diversify the group of people on the other side of the phone. And we've seen that countries with female leaders, countries with strong local community health systems have both come out much more strong during the pandemic year than other countries. And we need to make sure that that the work that we're doing is not invisible. And as we're isolating at home, we're not bumping into one another as often, not feeling maybe as much part of a community. We need to know that there are people who look like the rest of us, and really feeling that they represent all of us in the decision-making bodies of our various levels of government around the world. So I really want to, what I try to say to young people coming up is, use your voice, don't be shy. We really need to hear it, and we need those people to be you.
Amen. Amen. Okay, so what a great way to end. I will throw in one last little plug. If you are interested in these issues and shaping the public debate, consider the Dell Lana Fellowship of Global Journalism. That is not the purpose of this, but I did. There's so many folks on the call who are obviously interested in this. I would feel bad if I didn't promote the program. It's where we basically teach health professionals and scientists and others how to put things on the public discussion. Okay, enough there, but you can feel free to, if you go to the website, you'll see my contacts and email me directly. Okay, back to you, Gabriella.
Great, thanks, Rob. I think in wrapping up this conversation, we've already started planning for a part 2 of this panel around equity and perhaps addressing some of the questions that we didn't quite get to this round. So I just wanted to take an opportunity to thank each of you for being here today. I know that there was some preparatory work involved in putting this panel together, certainly in a virtual environment. So thank you for taking the time and for sharing so many nuggets and your wisdom with us. So we are very grateful. And I can say that on behalf of the PHAA, as well as our attendees, just a huge thank you for that as well. And so I'm hoping our participants on the line can stick around for maybe another 10 minutes. Part of this event today is also acknowledging and awarding the Public Health Alumni Association's Emerging Leader Award. And so we're going to spend the next 10 minutes or so with this. And so before we award and present this award, a few of the nominators of this year's recipient have shared a few words that I would now like to play for you all.
Congratulations, Michelle, on your Emerging Public Health Leadership Award. I thought it was so important to nominate you for this award because I have just seen you develop and flourish over the last several years so much. From my view as someone in the field, being on consultation calls with you, and just your enormous breadth of experience and knowledge related to public health practice and communicable diseases, to now working with you at Public Health Ontario and seeing your leadership within the COVID-19 response, still continuing on with critical subject matter expertise, but also taking leadership to coach and mentor others, including students, people who are reporting to you, and being a voice for vision and strategy around the COVID response. So congratulations again, well deserved. I feel so lucky to work with a colleague like you and hope you enjoy it.
So Michelle, would love to congratulate you on your award from the U of T Dalla Lana Public Health Alumni Association as an emerging public health leader. It is certainly awesome to see your work recognized. I know that we've come a long way from when we were both medical health officers on the West Coast, and now finding ourselves in the midst of this ongoing pandemic response in one of the hardest hit provinces in the country. And I just wanted to say, I think the award is well deserved. It is recognition of the work that you do and the enormous leadership that you demonstrate within the public health field here in Ontario and across the country. And I'm very glad that you're the recipient. Certainly we look forward to celebrating better days in the days to come. And I'm glad to have you on the other side of many outbreaks, many calls that we're working on together here with you at Public Health Ontario. Let's definitely celebrate both this award and the end of the pandemic once it ends. Wishing you all the best and congratulations.
My name is Monica Howe, and on behalf of Dr. Lawrence Lowe and I, we are pleased to congratulate Dr. Michelle Murty on winning the Emerging Leader Award from the Dalla Lana School of Public Health. Dr. Michelle Murty's tremendous contributions to public health, particularly during the COVID-19 pandemic, are much appreciated and recognized. During her role and time at Public Health Ontario, Dr. Michelle Murty has been instrumental in translating important knowledge and evidence and consulting local public health to ensure that guidelines are practical and relevant. Congratulations, Michelle, on this a fantastic achievement, and we appreciate, as always, your help. Thank you.
Michelle has shown outstanding leadership, collaboration, and expertise during the coronavirus pandemic in her work with the Office of the Chief Medical Officer of Health. Congratulations, Michelle, on this well-deserved award.
So I would now like to call upon Jennifer Bell, the president of the PHAA, to present this award.
Thank you so much, Gabriella. Thank you. And I think we have Michelle here. She'll appear in this virtual world that we're all living in. So it is my great pleasure to be giving the Emerging Leader Award today. And just a few things I want to say. This year we had a record number of nominations for this award, and it was a kind of a long adjudication process. As a result, everyone who served on the committee came back and said the same thing. What an incredibly impressive group of people all the candidates were. Not only were we struck by the talent and drive of our nominees, but also by the diverse paths they've taken after leaving Dalla Lana. Our alumni are ambitious, creative, passionate, community-minded, smart. I could go on, but it suffices to say that we could have given this award to every single one of the people who was nominated. That said, we were so impressed by Dr. Murty's accomplishments. And by accomplishments, I don't just mean articles published or job promotions achieved, although she has plenty of those. What really struck me was the sincere and warm admiration, and I think you can see it a little bit in those videos, the sincere and warm admiration and respect that her colleagues have for her. And when I think about what really makes a leader, it's not just the things that go on a CV, it's also the effect a person has on the people around them. It's showing leadership by the way you comport yourself in all your interactions, not just the ones that benefit you. So just to give one example, this award comes with a cash prize. And when we told Michelle she had won, the first thing she said was that she would like to donate her prize money back to the school to benefit students. I think that is the kind of leadership we really want to celebrate with this award. And so I'm delighted to present this year's Emerging Leader Award to Dr. Michelle Murty. Congratulations, Michelle.
She should be appearing on our screens momentarily.
Yes. Yes. She is.
I'm so thrilled and honored to be receiving this award. It's just really a pleasure. I want to thank the Dalalana School Adjudication Committee and Selection Committee for putting this award on. I think, Jennifer, to your comments, I wish you did have hundreds of these awards to give out, because I can think of so many people in our field who are deserving of this kind of award. I mean, I'm so humbled every day to work in public health, and the amazing colleagues that I have, and just seeing so much leadership, particularly in this last year. You know, I really, really want to thank all the people who took the time out of very busy schedules to have put forward this nomination for me. I was just very touched that they even took the time to do that, to think of me in this way, and to say very kind things about the ways I've been able to contribute, but really just a very much a reflection of just what a wonderful community we have, and being able to work with the colleagues that I trained with at the school and have worked with over the last number of years. And I think that that's probably been the main thing that's made this pandemic tolerable for many of us who are just very tired and burnt out from the process, but the joy and comfort that we have of leaning on each other and learning from each other, and that really makes it the reason that we all keep doing what we're doing, and very thankful for that. I think lastly, just to say thank you very much to my family, who's been incredibly supportive over the last year and many years actually, to help me achieve the opportunities and take advantage of things that I've been able to take advantage of. So really just very humbled and appreciative of being able to say that, to be the winner of this award. I mean, I'm a very lucky person to have been a U of T student, and now alumni and colleague, and now faculty at Dalalana. So I do really appreciate my connection to the school and all that's had to offer. And I hope I can help inspire other students going on to be future emerging leaders.
Well, thank you. Congratulations again. I like your point about the human aspect, and you know, these are tough times, clearly, very clearly, and so. And you know, those of course remind us of what's valuable and what counts. So thank you again, and congratulations. I also want to take a moment to say how extremely proud I am of my fellow board members on the Public Health Alumni Association and on our committees. Gabriella Luongo, who you've seen ably managing all of this, is our events officer. And Gabriella, you have done a superb job leading the organization of today's panel discussion. You make it look easy. Along with your team of public health sciences and IHPME alumni, Audrey Wong, Lara Gattoni, Taylor Martin, and Elise Davis. Thank you all. We've had lots of meetings late into the evenings, and it's been a great pleasure to work with all of you, and you've done a great job. Secondly, I don't think she's on today's, she's not on the call today, but Susan Campisi is our awards officer. And Susan, again, did an excellent job of managing the whole awards process. So thank you, Susan. And thank you all very much. I really appreciate it.